Welcome to Northern Light Eastern Maine Medical Center Emergency Department. The Emergency Department cares for patients with severe illnesses and injuries. Our goal is to evaluate, understand, and treat your illness or injury while keeping you and your loved one up to date with every aspect of your care. Having a medical emergency can be alarming, and you may have questions. The purpose of this video is to answer your questions and help you understand some of the unique aspects of care in the emergency department. We strive to make your emergency care accessible and straightforward, and we're here to help you every step of the way. If you have questions or concerns at any time during your visit, please let us know. Eastern Maine Medical Center is located at 489 State Street in Bangor, on the banks of the Penobscot River. The entrance to the emergency department is on State Street at the traffic light in front of the hospital. Look for the emergency department sign, turn into the hospital, and follow the signs to access the front door and parking. When you enter, some aspects of your care will begin right away. Upon walking through the entrance, you may be greeted by a nurse who will briefly evaluate your illness or injury and arrange for immediate care if needed. For the safety of our patients, visitors, and staff, a metal detector is located just inside the entrance to the emergency department. Our security team will guide you through the metal detector and answer any questions. Once you're inside the emergency department, the staff at the registration area will greet you and ask you to sign a consent form, which allows us to treat you. Then we will evaluate you in a private area next to the waiting room and ask you the reason for your visit. You may be evaluated by a nurse, a doctor, or both. This evaluation will help us determine the order in which you'll be seen. All patients are prioritized by the seriousness of their illnesses and injuries. If your needs are urgent, you will be treated promptly. Our goal is for a provider to see you within 30 minutes of your arrival so we can begin your treatment plan. If your care team determined during your assessment that it's okay for you to not be seen right away, you may experience a wait if the department is busy or if there are patients that need immediate care. We will keep you informed of possible delays and make sure you know what to expect. If you have questions about your care or when you may be seen, please ask at the desk. A guest Wi-Fi connection is available at no cost in the emergency department. You will not be required to enter a password to use this system. While we know that waiting can be difficult, we'll work to make your experience as comfortable as possible. We are committed to maintaining a healing environment for our patients. It is important that we maintain calm and courteous communication. For your safety, please ask one of our team members if it is okay to eat or drink while you're waiting. Eating or drinking may interfere with tests and treatments you may need. For your health and safety, tobacco use, vaping, and smoking of any kind are not permitted inside or outside the facility. Our tobacco and smoke-free policy applies to patients, visitors, staff, medical staff, and volunteers. Please ask your provider about tobacco and smoking cessation resources at any time. When it's time to be seen by a healthcare provider, a member of our care team will bring you to a treatment area. Patients may be treated in a variety of settings based on their individual needs. Our team works with each patient and family to ensure their privacy and comfort. Your medical exam will be performed by a doctor or other healthcare professional who specializes in emergency care with the help of others on our care team. If you need lab work, X-rays, or other tests, we will explain what tests you'll be having and why. This information will help us make an accurate diagnosis and develop the best care plan for you. Hand hygiene is one of the most important ways to prevent the spread of infection. Your care team washes their hands and uses hand sanitizer to keep you safe. And we ask patients and visitors to also clean their hands. For your safety, you are welcome to ask your caregivers to wash their hands at any time. We want you to be as comfortable as possible, so please let us know how you're feeling and if how you feel changes during your visit. If you are waiting for lab or imaging results, you may use our internal waiting area. This is a comfortable space that's located near your care team. To provide the best care, we must understand all aspects of your health. During your visit, we may ask you questions that seem very personal. This helps us make sure you're getting the right type of care. It's important for you to fully understand your care, so please let us know if you have any questions during your examination. For the privacy of our patients, visitors, and staff, Please do not take photos or video anywhere inside or outside of the facility. Please ask your nurse, a patient experience representative, or the supervisor on duty if you have questions or concerns. If you need to recover in the hospital, you'll be admitted to the medical center and treated by a new care team. Prior to going to your room, you may be cared for in the emergency department transition area while we prepare for your arrival. Your emergency department care team will make sure your new caregivers completely understand your condition, what care has been provided, and the next steps needed for your care. If you'll be going home after treatment, we'll provide education about your next steps for care and answer any questions you may have. You will also receive written discharge instructions. If there's something you don't understand, please ask. We want to make sure you have all of the information you need to recover as quickly as possible. When you get home, please take all medications as prescribed and schedule any follow-up appointments noted on your discharge instructions. We're here to help if you have questions. Just call us at 207-973-7304. Our goal is to exceed your expectations during your entire visit and make healthcare work for you. Your feedback will help us provide the best possible care to all our patients, including you and your family. Several days after your visit, you may receive a survey in the mail from our partner, Press Ganey, with questions about your experience. This survey is confidential. Thank you in advance for taking a few minutes to answer the questions and return the survey in the postage-paid, self-addressed stamped envelope. We appreciate your feedback. Thank you for entrusting the Northern Light Eastern Maine Medical Center Emergency Department with your care. It is our privilege to serve you, and we wish you a full recovery and a return to good health.